All right, Dr. Norton, we are live. So we'll give people a little bit of time to jump in.
Okay.
Here, we've already done a little bit of small talk since pre-gaming, but everything's okay with you and the family, right?
Yes, sir. Yes, sir.
All right, same here.
Right. How you? Everything's good.
Yeah, yeah. So our kids kind of had like a little bit of a hiatus from school over the past couple of weeks, and this weekend, once they extended the deadline, so to speak.
Right.
Um, Let me see. Now they're what is it? Distance learning. So
Yeah, virtual kind of stuff.
yeah, virtual. It's like he's got my son. I was looking at his schedule, so he's got a full schedule this week. So
Okay.
from 8:30 this morning until 3, they're like doing virtual learning, distance learning, and stuff like that. So my daughter, she's in the 5th grade, son's in the 6th. So
Okay.
her schedule not as much of a load as his, but he's doing some heavy lifting right now.
Are they now in Virginia? They mentioned they're not going back to school at all for the year. They've canceled. How is it where you are?
I haven't heard that they are going back to
Okay.
school. I don't think that they've canceled it for the year yet.
Right.
They keep extending like the dates out,
Right.
but
Right.
I have a feeling that we'll follow suit with Virginia.
With the cancellations and stuff.
Yeah, with the
Yeah.
cancellation. Our kids, they go to a private school, so I don't know if they follow the same rules as the state, which I'm sure they will and they should.
Right.
But I'm not exactly sure how that's going to play out for them.
Yeah.
Yeah,
It's
yeah, yeah.
I
So I
think this.
see a
Okay.
few people joining us. You guys, as when we go further along into this, be sure to ask questions. Please ask some questions. I have Dr. Marquis Norton on here. He'll tell you about himself, but trust him a lot. Know him from a very reliable source, and just someone that I think could help us get through a few things here. Obviously, like I was talking to Dr. Norton earlier, I could sit here and talk about mortgages and finance until I'm blue in the face, and that stuff's important. But the goal is to also to be able to help our network, to help them get through this difficult time right now. And I know because I go through it on a daily basis. Anxiety and stress is at a heightened level. We talked about the fact that this is a pandemic, right, Dr. Norton?
Mhm. Correct.
Even more so now. So real quick before we get started, can you tell us a bit about yourself, sir?
For sure, for sure. So, my name is Dr. Marquis Norton. I am a therapist in the Southern Virginia area, Norfolk, Virginia Beach, that Hampton Roads. I'm also a professor at Hampton University. At Hampton, I teach in the Department of Counseling. So, people who are aspiring to be therapists, school counselors, addictions counselors, and things of that nature. Um, Last year, I opened up my own private practice, and yeah, that's a little bit about me, a little bit of an introduction.
Okay, thank you so much. So like what they call elephant in the room, $1 million
Mhm.
question, so to speak. Like what are you seeing right now, like in regards to your clients and your friends and people that are reaching out to you? Like what's the most like common question that you have to help deal with?
Yeah, I think you tapped on something a little earlier. So stress exacerbates depression and anxiety, right? So if I'm dealing with, let's say, depression scale of 1 to 10, a 4, on average, if we add a high stress situation, that could go up to an 8 or a 7. I think the main thing people are trying to do is trying to figure out what the new normal looks like. For a lot of my clients, it's parents with young children, and they're trying to adjust to the school schedule versus being at home and handling chores and behaviors and things of that nature. And with the older college age young adult, uh, mostly some concerns about like financial security, concerns about jobs if they're not able to work from home. But I think overall the underlying thing is how are people managing and dealing with stress, for sure.
Okay, so that leads me to a few questions. I fielded some questions prior, and then,
Mhm.
like I said, for anyone that's watching or listening to this, if you wanted to pop into, we're on LinkedIn Live right now. also Facebook. If you wanted to put any questions in here, it'd be awesome, because it's a really good opportunity for us to at least get some of them answered. So one of the questions, Dr. Norton, is how do we help kids cope with not seeing friends or not being in school or able to do normal activities?
Yeah, so I think the biggest thing, depending on the school system, a lot of school systems are going to virtual learning. And there seems to be a trend amongst teachers to where, let's say class starts at 11 o'clock. Class will start at 11. The teacher will allow the students about 10 minutes to interact with each other. And then the actual academic stuff starts at about 11:10. But I think the biggest way that kids could connect with each other, social media, gaming, FaceTime, just things that are distance, you're able to kind of practice social distancing, but still also connect with people. It's not the same as being in person, but I do think that, it brings a sense of community. It brings a sense of support. So just however they could connect, whether it's games or, FaceTiming, like I said, or social media, for sure.
Okay. So the other question, like in regards to, you mentioned some of your older friends are, concerned about finances and getting back to work and such. Obviously that's something that we're all trying to figure out ourselves, and the powers that be are trying to figure out how to stabilize the economy and all that good stuff. But behind the scenes, we have to find ways to continue with our lives and to stay motivated, right?
Right.
So what do you have any tips and secrets? I don't know if they call them secrets, but any tips for us to stay motivated during this time frame?
Yeah, I'd say the biggest thing to stay motivated, while everyone's, first of all, stay home, right? Because we want to make sure that everyone's safe. And I think that in therapy, it teaches us that our mindset really affects the way that we behave. So we don't want to have the mindset of I'm stuck at home. We want to have the mindset of I'm safe at home, right? So if we have the mindset of I'm safe at home, we want to try to create like routines. So whether that's, all right, get up in the morning, take your shower, practice your hygiene and those things, but work out, get some work done, whatever your routine is. I think that's the best way to stay motivated. A lot of times people lose motivation. They feel, helpless and worthless when they're stagnant. So, if I'm sitting home for a week, binge watching Netflix, whatever responsibilities I have, those are just going to kind of accrue and accumulate. So we want to be able to kind of small steps, set daily goals, have some kind of routine, and kind of keep ourselves up. I know a lot of people, if you're staying at home, you could be in your pajamas for, a day or two, but we want to kind of practice those, get up, take a shower, eat your breakfast, get a workout in, set some time aside where you can actually be productive. But I think the biggest thing is going to be definitely setting those daily goals.
Got it. A friend of mine, I was on social media this weekend. He's in California. And he's a tailor, so he makes fashion like suits and stuff like that.
Right.
And he's like, you know what, man? I get up every morning and I put my suit on and I go work at my kitchen table.
He keeps it going. I read that book. What is it? Make Your Bed.
Yeah.
It was by So, and just for me, getting up, making my bed, those things help. It gives it a sense of purpose. It also gives you a sense of accomplishment, for sure.
Got it. Depression. During these times, do depression set in for some people?
Yeah, for sure. So one of the major criteria or symptoms of depression is people tend to self-isolate. So with the quarantine, it's kind of mandated that we stay home. It doesn't necessarily mean that we isolate. So to mitigate like depressive symptoms, we definitely want to try to connect with people. Group FaceTime is a great thing to do. Skype, Zoom, all these things are really important, but just kind of being able to get the community together is really important. I'm seeing a new trend on Instagram where people are going live and having like these Instagram live parties. But I think that's a great way for people to understand that they're not in it alone. A lot of times when people are depressed, they feel like hopeless, they isolate, no one really understands what they're feeling. But the more you can connect with people, I think that will definitely decrease the depression. And they're also tapping into whatever your coping skills are. Some people like to exercise, some people like to meditate, some people like to journal. Whatever helps you is going to be important as well.
Got it. So there's not really like a one size fits all.
Nah, not a one size fits all. But the main thing is going to be the biggest one size fits all is going to be staying connected with people for sure. Staying socially connected.
Understood. So I'm going to hit, we have a couple questions.
Okay.
What are some tips you have for someone becoming anxious about the future?
All right. So one thing about when you say anxious about the future, I think everyone is a little uncertain, right? I think when it becomes diagnosably, anxiety becomes diagnosable is when we overestimate the worst possible situation that can occur. So the first tip I'm going to give for that is try to reduce the intake of media, because there are so many stories that are out there. I mean, CNN's one thing, but if you're into like social media blogs and all these kind of things, that could definitely heighten your anxiety. So we want to make sure that we limit our media intake for sure. That's going to be the first step. And then second of all, like I said, everyone's a bit anxious about the future, but it's just about how intense is the anxiety. Is it an anxiety that, you're not able to sleep, you're not able to eat, it's something that's consuming or ruminating all day? Or is it something that's like, I'm concerned about my loved ones, we're at some distance, because some of it's normalized, but then some of it could be like clinically an issue.
Got it. Understood. So my biggest thing that I'm taking away from that, at least that I'm practicing for myself, is the reducing the media intake.
Yeah, for sure.
I've always been that way anyway. My wife, she teases me because it seems like I don't know a lot that's going on. I know enough, I hit the headlines and, gather what I feel is very important. But I always try to feed myself something positive,
Right.
Just to dwell on the negative aspect. And I think that's something we need more than ever right now.
For sure. And there's so many, I hate to use the term, so much fake news that's out there that, if you're consuming all of it, you don't really know which way to go. I would say just try to limit your media intake. Like you said, hit the headlines, stay informed, but you don't want it to consume you.
Last thing on that piece, is there a time of the day where, maybe we should be checking in or out, like, or does it really depend? Like, so like, for instance, if I get bad news in the morning, it sets me up for a bad day a lot of times.
I see what you're saying.
You know what I mean? Like,
so, I think that's going to be more of a personal preference. So like me, for example, if I read something bad in the news in the morning, it may not really change the trajectory for my day. But other people, like you said, like yourself, it could be different. So I think that's just going to be personal preference.
Understood. Another question. Most people struggle in figuring out how and where to find help, as well as the financial resources to cover it. What's your step-by-step process of how to seek out a therapist?
First of all, what's up, Sharon? Yeah, that's a great question.
Yeah. So basically, what is it asking? How do you seek out and get a therapist?
Right. So one thing, because of this whole pandemic, 95% of insurance companies have okayed telemental health, right? So before, it was kind of like one of those things that was on the fence, like, it's appropriate sometimes it's not. But if you have insurance, you're able to definitely have some resources. On the back of everyone's insurance card, there's a number that says behavioral health. And you can always call that number and they'll be able to give you local resources that are in network for your area. Another option that you have is psychologytoday.com, which is a directory of therapists, psychiatrists, psychologists, and you can search it per area. I like psychologytoday.com because you're able to read a little bit about the therapist. You can see a picture just to make sure it's a good fit. So as far as that's where you can find one, resources to cover it. So if you go through your insurance with therapy, you only have to pay your copay. So depending on what your copay is, whether it's $20, $30, but your insurance company covers it. And like I said, this could be a good time to reach out and talk to someone, because all insurance, like I said, 95%, not all, are allowing consumers to do virtual sessions. So you can be right in the comfort of your home. If therapy is something that you were thinking about before, this is definitely an opportunity to do it. And then you also have drnortontherapy.com, which is another resource.
Nice. Mr. Hidaria said no softballs, but that turned out to be a great softball. So
Okay.
um, that also is another question for me. Like for instance, technology is proven to be playing out in a major way for us to get through this pandemic and these times. It's always been my take that, therapists, you go in person and sit on the couch, right? And
Yeah.
and you speak to someone. So it seems like the virtual sessions are something that's becoming a thing, and I'm sure they have been over time anyway. But is there a preference, like I
think
one that works better, than the other?
Right. So the virtual stuff started. Well, I don't want to say it started, but it became big when, for prescribers. So let's say you have a psychiatrist, and there's a limited amount of psychiatrists in Norfolk. Let's just say. So they call it telepsych. You were able to have providers from the hospital, and they can see people in different areas and they could be stagnant in one place. I think that my preference is definitely in person. You're able to connect with people more. You have more nonverbal cues. But the circumstances that we have, all my clients have pretty much shifted to virtual. I think virtual is a little better if you've seen someone in person first, but depending on the circumstances. But I would say my preference would definitely be in person.
In person. All right. And so how do you see it playing out, like moving forward in your world?
Yeah, so I've had experience doing the virtual stuff from when I was employed by the hospital. So I was able to screen people through the virtual to see if they were like suicidal, homicidal, if they need to be hospitalized. So I know some best practices, but I think that this quarantine is going to push us into the information age a little bit more. And I noticed with the kids, they tend to like their phones, they like technology, it's a comfortability toward it. So I think that this is going to push information and technology, not only in therapy, but in everything.
Got it. So I have two more questions for you. Loneliness, right? We talked about depression a little bit. I don't know if there's a difference, right, between depression and loneliness?
Loneliness is a symptom of depression.
Okay. So
it's one of the symptoms, if that makes sense.
One of the symptoms that can lead to depression.
Right.
So how do you handle that, like in these stages? So there may be elderly people, or not even elderly, but just people in general that may have lost a parent or, a sibling or, a loved one that misses that person. Or there may be someone that doesn't have this technology and the ability to connect like many of us do. And then you start to sink into loneliness that could potentially get into the depression. Is there any coping mechanisms or any tips and advice that you can give for someone in that situation that is lonely?
The best way to mitigate loneliness is going to be social interaction. If the technology is limited to where they can't do, video calls, there are different like online support groups. So I know Facebook is creating a lot of groups for people who are in quarantine and want to connect. If they have no technology, unfortunately with the quarantine, I'm not really sure how you can socially connect because, everyone's in home. Phone calls is one thing that you can always do. And there are tons of hotlines. There are depression hotlines. There are, peer recovery specialists. Sometimes it helps just to speak with someone about what's going on, just so that you're able to connect with someone. You're able to kind of make your thoughts tangible. And I think that, like I said, the social connectedness is going to be the best way to mitigate the loneliness. Now, on the flip side, if you have someone who you lost and, you're dealing with some grief, one thing my family recently started doing, like my mom started, it's like scheduled FaceTime calls. So like, 10 a.m. on Sunday, everyone kind of gets on the FaceTime. And although we're in different, and we're in different states too, by the way. So my mom's in Virginia, but the rest of my family's in New York. But it still brings a sense of that camaraderie and that community, which a lot of people need to, get through this pandemic.
Got it. So you've been very generous with your time. I'm going to take one more question for you here. When we become overwhelmed, right, do you recommend any tips for keeping your cool? For example, like Dr. Norton, any breathing techniques?
Yeah, so I think mindfulness meditation is a great one. So that is about being able to kind of tap into the present. So there are different ways you can do mindfulness. One thing is you can focus on your breathing. Another thing is, you can focus on the different senses that you're feeling at the present time. But just being able to meditate and kind of gather your thoughts and ground yourself is going to be really important. There are a few good apps that help with that. Like we said, we're talking technology and stuff. Calm app is a good one. Headspace is a good app, and Stop, Breathe, Think is also a good app for being able to Zen, I'll call it. Also, if someone is dealing with a specific mental health issue, whether it's depression or anxiety, therapistaid.com is a really good resource to where you could print out worksheets. You can work at your own pace, but it's just something that you could do definitely to take a step in the right direction.
Headspace, English Andy.
And who's English Andy?
So on Headspace, I use Headspace sometimes to meditate.
Okay.
And, one of the voices, the narrators that help you get through the
is English Andy. Okay,
yeah, I call him English Andy.
Gotcha.
Yeah.
And another thing that helps, I know everyone is, we're dealing with the quarantine. It's on one hand, people are bored. On the other hand, people have these responsibilities. I bought a jump rope that helps me. Just kind of being able to relieve some steam. We can't go to the gym, but, just finding different things. I know a lot of people are gardening nowadays. It's hot in Virginia. It was like 80 degrees yesterday. But just being able to kind of tap into different projects that you were wanting to accomplish, now we have the time.
Yeah, I was going what I guess they call stir crazy yesterday.
Were you?
So, yeah, so I did what you told me not to do. I started going online and I looked up, is it safe to run and cycle?
Right.
So I have a bike and I'm going to ride my bike today because they say it's very safe. To do so is just as long as we distance ourselves. So that would be similar to your jump rope.
Right, getting the blood going. It just helps. It helps for sure.
Got it. And so last thing that we'll leave with, your TikTok is phenomenal. Like,
thank you, man. Thank you.
Yeah, I go I don't, TikTok, I'm new to it and trying to understand it. And I see all these folks dancing and do all these challenges and stuff like that on there.
Right.
The way that you present your information on TikTok, I've told you this. I think it's pretty amazing and phenomenal, and it sticks with us in a way that we kind of understand what we're talking about today. So, real quick, can you tell us where to find you?
For sure.
So for sure. Two things. Tell us what your thought was about TikTok and why you felt like that was a good platform for you to get this information and message across. And then lastly, just tell us how to get in touch with you.
Okay. So we'll talk TikTok. First, someone had a question about the app, so I want to answer that. Shout out Rico. Thank you, Rico. And then the app, the first one was Calm, the Calm app. So, all right, I wanted to answer that. Right. So why did I get into TikTok? So I felt like it was so I'm on TikTok. The dancing is one aspect, right? The dancing is a way to make information consumable. But I just thought that it was a short segment to where you could do videos and be able to provide content of value to people that's easily digestible. When I started, I was in the process of trying different things. I tried the podcast, I tried like the Facebook videos, I tried the Instagram videos. I feel like my Instagram videos were a bit dry, and I felt like TikTok was a good balance of being able to kind of show like authentically who I am, but then also kind of promote like the profession and different things that people can benefit from. So
it works. It grabbed my attention. I see all these words popping up.
Yeah, the words are showing up in between moves and stuff like that. Yeah.
Oh yeah, because it just even things that I never thought of, like we're talking about, loneliness and depression and symptoms, things like that. That kind of content and information. Well, that type of information is in your content that you have on TikTok. So great job with that.
For sure. Thank you.
How do we get in touch with you? How do we find you?
All right. So drnortontherapy.com is my website. I do virtual sessions. Like I said, I'm located in Virginia, but I can reach anyone in the States. My TikTok is Dr. Norton Therapy. That's DRNORTON therapy. Instagram, Dr. Norton Therapy. And then my Facebook is Doc Norton, DOCNORTON. Someone had the other one, but those are ways to contact me. If you have any questions, feel free to reach out. You know, I'm here to kind of meet the people where they are and definitely try to help. Yeah, definitely try to help for sure, for sure.
Okay. Hey, this was awesome. Thank you so much.
Thank you so much. Thank you. Thank you.
Yeah, we're all going through it right now. You know, like I said, you know, I'm in the mortgage industry. I talk about rates and all that. Like, so for right now, it's very stressful in our world because guidelines are changing. Because
Okay.
you know, even the lenders and the servicers behind the scenes, the investors that buy our mortgages, they're a little bit spooked. They don't know exactly what direction to go in regards to to their purchasing loans and such. And so that's creating a ton of stress in our world because guidelines are changing every day. The way we do business is changing. Interest rates going up, down, things of that nature creates some stress on our end because we want to be able to fulfill what we promise. But then we also have our clients that are out there that are worried about whether they're getting what they should get or what they're supposed to get. And so it's happening across the board for everyone. And the biggest thing is just like we talked about, like I could kind of care less about that kind of stuff. It's really about the people. You know, we want to make sure that everyone is getting the information that they need to get through these difficult times. And so we both have networks, and just to be able to provide this information out to our networks just to help someone get through the day today is so important. And so, you know, if this helps and gets them through the next day and the next, then that's great. But the biggest thing was just providing this content today to help someone. So thank you.
One question, sorry, before we leave.
Yeah, no worries.
With the housing market, does this remind you of 07, 08? Like before the
similar, yeah.
little bit.
What reminds me of 07 are the constant changes and stuff that are outside of our control, in which there's a bigger picture financially behind the scenes, and everybody's making moves and maneuvering in order to protect the economy and to protect their companies and to protect the housing marketplace. So in a way, yes, because of all the changes and uncertainty, but the other way around, no, because we weren't really operating in a way that it was also affecting our health. You know, there was no other outside influence other than the economy, other than money, right? So now we have health, mental health, and money that's involved with it. So definitely similar because of our mindset and the way we had to think about things and a bunch of changes, but not really the way we're operating and doing business now. I think they're actually doing a really good job, at least in the housing space, to overcome any challenges that we're having. And like I said, technology's coming through in a major way. You know, with the pandemic, we were, facing issues with appraisers and homeowners, like maybe not wanting appraisers to go into their houses because of the social distancing and vice versa. Closings. So for instance, if you settle on a house, it's paper, you bring paper in, you take a pen and you sign it, and that has to be done face to face. So there's some things that we're working on there to overcome that. Also documentation that we're getting, a lot of it's electronic now, whereas before
to the information age.
Yeah. So before, back then, you'd have to actually physically go and gather that information. So that part's changed, but yes and no. A lot of yes, but definitely the major no is the health piece with it. So I'm not sure if I answered your question, but it's
no, you answered it. You answered definitely.
Yeah. So it's I do think we're gonna be getting as we have, like, it's $2 trillion that they're putting. What is it? Trillion dollars that they're putting into the economy for stimulus and such, and it's helping. Education is helping finances, banks and large corporations to help us sustain through this all.
Right.
but it's going to take a major effort financially to help us get through this all, because, businesses are being shut down again, like I said, due to health,
Right.
which is leading to the financials
Right.
situation. So it's not
Everything's kind of tying together. Yeah.
yeah, like before, it wasn't like we couldn't go to work. Now we can't. In some situations, we can't
You can.
physically. They
Right.
won't allow us to work.
Uh-huh.
So it's definitely a trying time. I've been challenging all the friends and family and folks that I know in our space to kind of think outside the box and figure out how we can fill gaps. And so I think that's something that's going to be very important for us as we move forward. It's just
Things like this that you're doing, man. Just connected with the people. For
yeah,
sure.
yeah.
All this stuff. Yeah.
That's the most important thing. On Thursday we'll talk more about appraisals and we'll talk business. But like this was on my heart because it's like I'm trying to figure out ways to help people, to help as many people as I can. And so I know I have, I'm not a psychologist. I can only state what I use for my coping mechanisms and what my beliefs are. So I wanted to bring people in your space because this is what you deal with and this is what you have dealt with. And it's been very helpful. So anyone that's listening to this and have questions about the housing piece and the aspect of where it's going and what the differences are, feel free to reach out to me. You can DM me or contact me through, any of our social media channels, or just email me at Shawn, SHAWN at FortisMortgage.com. Cell phone number is 301-807-8488. And we'd be happy to help. Dr. Norton, thank you, sir.
Thank you so much. Appreciate your time. And, everyone that's listening, you guys be safe. We'll all get through this together. Everyone's trying to figure it out, but, we'll keep going. We'll keep going. And DrNortonTherapy.com.
All right. Be good. Thank you.
All right, man. Peace out.